Good evening, everybody, and welcome to our live Q&A session with Dr. Nick Sekhar and Dr. Melissa Mastroianni. Dr. Nick Sekhar is our NYBG bariatric surgeon, and Dr. Mastroianni is our NYBG plastic surgery plastic surgeon. So thank you, everybody, for joining us, and we're going to go ahead and get started. So I will turn things over to you, Dr. Sekhar.
Thanks, Megan, and thanks to our audience and participants. We appreciate you. We're happy to answer your questions, and I thank Dr. Mastroianni for joining me tonight. We've been extremely happy to have her join our team. Our patients, our staff are lucky, very lucky to have her, and she's already gotten off to a great start, providing excellent care and successful care to our patients. So that's one of the things that we take pride on at NYBG is our service to that patient and the offerings that we have for our patients. So one common concern for many of my patients, and at actually every new patient visit that I see for bariatric surgery, the most frequent question I get from patients, from every patient, is what will I do with the extra skin after significant weight loss? So what can you tell our prospective weight loss surgery patient about that, Melissa? What do we do with the extra skin? Let's say we have a patient who starts off at 300 pounds and has a successful outcome after a sleeve gastrectomy, and then a year after the surgery is down 100 pounds and has concerns with extra skin. What do we offer that patient?
Well, thank you for the wonderful introduction and all the kind words. I'm super excited to be here too. So the cool thing is we can really tailor the experience to every patient. And people feel guilty. They say, I go to the gym all the time. How come I can't get rid of this extra skin? Skin is a problem. It doesn't always tighten up. Some people get lucky, some people don't. And it really just depends on a lot of different factors that we don't even understand fully. So generally, we recommend surgical removal of the skin. And certainly you've been through a surgery before when you've had your gastric sleeve or any other bariatric procedure, but this is a different kind of surgery. It's actually just skin surgery. Most people are afraid of the big incisions, but from a pain standpoint, the recovery is not too bad after a skin excision. So we talk about your goals. I sit down, we look at your skin together. We talk about areas that are important to you to address, and we make a plan custom for you. So everybody that walks through the door gets a custom plan when they meet with me.
Yeah, and that's what I've been hearing from very happy patients who've met with you, that you do listen, you do take the time to listen to their concerns, and you have the hand of an artist, as we are lucky to have our patients come under your care. And so they have a beautiful outcome with the skin removal surgery. So one other question that I hear often from patients is, can I have multiple body areas addressed in one surgery? So they may have extra skin in the abdomen, but as you've seen, the extra skin doesn't just stick to one part of the body. It may be in the arm, it may be in the leg. So is it possible to have multiple body areas addressed in one surgery, or does it have to be a combination of surgeries? How does that work?
So generally, the more areas we work on, it adds time under anesthesia. And we want to be cognizant of that. We don't want you to be under anesthesia for 24 hours. That's too long for your body to handle. It increases your risk of complications too. The longer the incisions your body has to heal, the more likely you are to have some complications. So my general rule is about 2 body areas per surgery. And there are a variety of sets that can go hand in hand. Sometimes people want their belly and their breasts addressed. Sometimes people want breasts and arms addressed. Sometimes we like to focus on the trunk, and you get the extra skin removed not only from your belly, but your back too. And certainly if there are some smaller areas, we may be able to combine those into not just two. But I really strive to keep my OR times under about 6 to 7 hours because I don't want to keep my patients under anesthesia that long. We want you to have a good outcome. So when you come meet with me, generally we'll identify the main problem areas. We'll identify some pairs that make sense. One pair that definitely doesn't make sense is arms and legs, because you're going to have trouble getting around. It's hard to take care of your wounds after that. So we pick things that make sense to you. And then we can stage a lot of these other surgeries. So the closest we would do the next stage or the next body areas would be about 3 months.
And, another question that I hear from patients, we do have a brand new surgery center. Is this something that always has to be done in the hospital or require an overnight stay?
No, a lot of these procedures, surprisingly, we like to send our patients home. You're going to sleep much better in your own environment. We give medications to help you with pain management afterwards. A lot of them are not even narcotics. I like to use a lot of local numbing medicine to help out. So a lot of our patients are very comfortable going home. You don't have to stay in the hospital necessarily. Some of the more bigger procedures, if we were to do, both a front side and a back side, we may just want to keep you to make sure that you can walk around okay. But absolutely, a lot of these can be done in a surgery center. And one of the beauties of that is it's a more private setting. You get a very personalized experience there. It's wonderful that you are in and out. The facility is lovely. It's brand new. We have wonderful staff that we worked with, and not just whoever's assigned to the case like at a hospital. So I do love working at surgery centers for a lot of reasons.
And, one other common concern for patients is the cost of the procedure.
Mm-hmm.
Everyone thinks about plastic surgery as being a cosmetic procedure. Oh, I'm going to have to come up with a big check to cover the procedure. Are these procedures that can be covered by insurance in some cases?
Some of them can be, and we work really hard to get our patients covered for as many of these procedures as possible. Things that you can do as a patient if you're having problems with skin, rashes, moisture buildup. I'm sure you're doing a lot of wound and skin care on your own. If you can start mentioning these things to your bariatric surgeon, your weight loss doctor, or even your primary care or gynecologist, it builds a paper trail. And what we're trying to do is demonstrate that you have a functional problem with this skin. And sometimes insurance says no, but I go to bat for all of my patients and I call them up. We fight for you. I want you to have an excellent result. I don't want you to pay me $1 million. And oftentimes if we can get insurance to cover a lot of the things, maybe we can add in a little bit of liposuction to really make your results pop. And that would be at a nice discounted fee if anesthesia is being covered partially by your insurance. So we do a lot of things to make it affordable for as many people as possible.
Yeah. Well, thank you for those answers, the frequently asked questions that my patients often ask.
Yeah.
Are there any questions that your patients have had for you, not about bariatric surgery?
Yeah,
that
certainly.
I can be helpful to answer.
Certainly, I see people come in and they've gained some weight. The mommy makeover is a common request, but oftentimes patients are heavier than they've ever been. And they say, I don't know what happened with this. I've been dieting and it's just not working. And I know that there are some surgical options, but what exactly are the types of procedures that we can do for these patients to help them with their weight loss when they struggle so much with diet and exercise?
Yeah, and that's really the benefit of seeing surgeons in our practice. I've had experience going back to 2002 with this surgery. So when I started doing this surgery, it was the open surgery. It was the open gastric bypass surgery. And I was there for the transition between open surgery to laparoscopic surgery to now endoscopic surgery. And I've seen several trends of medical weight loss and medications for surgery. So the benefit that one of your patients or any new patient has in coming to see us is the benefit of those many years of experience and not having a one size fits all for each patient. Because I have experience with medical weight loss and all different types of surgery, including revision surgery, I can tailor that approach. I'm not going to force a patient to go for surgery or only have surgery as an option for someone who wants to go for medication and diet as a first-line approach. And if a patient is going to see a doctor who only specializes in one or the other, the natural tendency is going to be to tilt the patient towards whatever approach that surgeon or doctor is comfortable with. So we don't have a one-size-fits-all approach. And what it comes down to is both what I feel works best from my experience of doing over 3,000 of these surgeries and doing this type of care for over 20 years, is that I can quickly come up with a very successful plan for a patient based on their previous medical history, their previous surgical history. So it's not a one-size-fits-all approach, but one thing that we do offer, and we do offer for many of our new patients, are the new medications that you've seen on Instagram or TikTok or all over social media. And those are the GLP-1 agonists like Wegovy or Ozempic. You don't have to go to someone who's just started prescribing this 3 months ago and has no idea what they're doing. You can see somebody who actually knows what they're doing and can plug you into a machine where we have all of the support at your disposal. So not only would you get a discussion of diet, exercise, and access to psychologists and dietitians who've been doing this for over 20 years, but we also have that support network and the infrastructure to offer you surgery in the future if you came to that decision on your own. So we have many patients who've started with medical weight loss and ended up with surgery, and we've also had patients who started with surgery and ended with medical weight loss. So what we have to do is leave this paradigm of it being success versus failure. This is a continuum of care. So when I liken it to a patient who comes in with a heart blockage, we don't send that patient home with one stent for the rest of their life. And then if they had another blockage, they wouldn't get more treatment.
Right.
Or we wouldn't take them off of Lipitor or aspirin. So this is a lifelong disease. It's a something that we have all the tools to assist you through that lifetime of care. And so that's why we want patients to stay engaged with us, follow up regularly, and be able to offer them the care that they need at every stage of this disease process. It doesn't mean that you couldn't have one surgery or one medication and be successful. But I just want patients to know that we're there for them at every step of the way, and we have the right tool to offer them at each stage of this journey.
I think it's really awesome that our group offers that full portfolio. You know, I've seen patients who are absolutely terrified of surgery, and I say, go meet with the surgeon anyway. You never know what you're going to hear. But a lot of them are scared of the risks of the surgery. It's a big surgery. You're going to rearrange my insides. What do you counsel patients when they say, man, surgery's scary? I'd rather take a pill or a shot.
Yes. So, the first thing you have to do is listen to what the patient is telling you. Nobody wants to be forced or strong-armed into doing what they're not comfortable with at that point. So I never issue edicts. I listen to the patient, and I want my patient to have autonomy in their health decision. So I give them the alternatives. And by the end of the visit, you still don't have to sign on the dotted line for surgery or medication. You have time to think about it. So we have a dialogue, and it's an ongoing discussion. But what I do tell to patients who are scared of surgery and do qualify for surgery is that the surgery is extremely low risk in an experienced surgeon's hands. So I've done over 3,000 surgeries. I do, anywhere from 10 to 15 surgeries a week, some months on average. So I wouldn't be doing that many surgeries if I didn't have good outcomes. And because I do so many surgeries, I have good outcomes. So it's an ongoing process of learning, adapting to new techniques. And that volume of surgery gives me a technical skill that leads to better outcomes for the patient. So it's been well studied. It's more harmful to stay on the wrong treatment than it is to go for the right treatment. Your risk of long-term illness goes down significantly with the right treatment. And if your BMI is over 35, the American Society of Metabolic and Bariatric Surgery does advocate for surgery as the first line of therapy. But we understand that patients aren't always comfortable with that being the first line approach. So we are there to get patients to that comfort zone with surgery. And we are very willing to start people on medical weight loss, which includes diet counseling and prescription of these medications. And it's not a cookie cutter approach where everybody gets one medication or the other. There are different types of hunger and there are different roles for different medications. And that's what we have the expertise, and our PAs, our nurse practitioners, our dietitians all have that extensive and long experience with managing these concerns and chronic conditions that plague many of our patients.
I have some more questions, but there's a question that I wanted to address in the chat box. Somebody is looking for a paniculectomy. So paniculectomy is a fancy word for removing that extra skin that overhangs the pubic area, the mons. Great candidates for this procedure are people who have stabilized in their weight loss. Insurance generally wants you to have your weight be stable for a good 3 to 6 months. So not actively be trying to lose weight. And we also like to see 3 months of documentation where you've been treated for rashes or needed antifungal powders or creams or ointments. And those 2 things are generally the big things that insurance companies ask me to demonstrate in order to get the paniculectomy approved. And then the final thing is you do have to have an overhanging apron of skin. You know, unfortunately, those big beer bellies, unless it overhangs your pubic symphysis, they're going to say this is just cosmetic. And that's where I can see you in clinic and we can take pictures and we'll talk about the things that you need for documentation. That brings up a good point. So say your patients have their surgery, and they undergo the weight loss surgery. What is their weight loss trajectory? What does that look like post-op?
Yeah, so that is a very common question as well. And it varies. That's the short answer. A big, tall man who has 100 pounds to lose could lose that in 6 months. And a shorter woman who has 40 to 50 pounds to lose could take a year to lose that weight. So everyone has different metabolic rates. It tends towards taller men lose weight very rapidly because they have a big frame that they can have a lot of muscle on, and that generates a lot, burns through the extra energy that's been stored on their body a lot faster. But typically a safe rate of weight loss is in the 1 to 2 pound a week range. So you don't suddenly lose all your weight within 2 weeks and turn into a stick figure with extra skin hanging off of you. But it is a safe rate of weight loss, and it's a comfortable rate of weight loss after the procedures that we do offer. And, going back to your previous question on safety, another safety concern that patients have, it's gotten so safe to do the surgery that we send patients home from our surgery center within 2 hours after the surgery.
You get to do this in an outpatient setting?
Yeah, so we can do the sleeve gastrectomy in the surgery center in Stamford, and patients recover at home. And what's interesting is that my patients who recover at home feel much better at the 1 week post-op visit than the patients who spent the night in the hospital. It's counterintuitive, but they overall felt better to recover at home than to spend the night in the hospital. And that varies per everyone is different, but just an interesting thing that I've noticed since we started doing that type of surgery in the surgery center is that same surgeon, same assistant, same surgery, but the recovery and how the patients felt at the 1 week was much better.
Wow. So they do the surgery, and do they have to, after you shrink their stomach, do they have to live on liquids the rest of their life?
Yeah, and that's a common concern for many of my patients is that they will need to be on a special diet for the rest of their life. They'll be sipping on a protein shake at Thanksgiving while everyone else is enjoying turkey and all the fixins. But that is more of a fear than an actual concern after the surgery. You do have to be on a special diet and take special precautions for the first month, but eventually you will be able to eat the food that you like within reason. So my patients are often on solid food within 2 or 3 days after the surgery. So it doesn't mean that you have to be on shakes or soup for the rest of your life after the surgery.
So how do you determine who's a good candidate for bariatric surgery? And, does that factor into insurance coverage for these procedures?
Yes. So there are some insurance criteria that do have to be met to have your surgery covered by insurance. And the primary and arbitrary measuring point that we use is called the body mass index, so BMI. And that's a function of your height and your weight. And it's something that you can figure out for yourself if you know your height and your weight. You just Google a BMI calculator and plug your height and your weight into that, spits out a number. The magic number is 35. That's where surgery is covered. There are some insurances that still require you to have what's called a comorbidity. That could be fatty liver, that could be sleep apnea, could be high blood pressure. But the ASMBS criteria, which hadn't been updated since 1991, were recently updated last year and do support surgery without a comorbidity, even at the 35 BMI mark. And we have gotten some success by sending that criteria into medical directors and insurance companies, and they have been more likely more recently to approve patients without those comorbidities. But it's always safer to have a sleep study or some other documentation that helps you get coverage for the surgery. And like you, I've had many conversations with the medical directors and different people at the insurance companies, and we are very strong advocates for our patients as well. So I go to bat. I give the medical director nightmares after our conversation, but we are your advocates. We are definitely going to go to bat for you when it comes to getting these procedures approved. And one question to segue into a question that one of the participants on the meeting asked is, do they still do the dye test after the sleeve surgery? We do. And that is something that we found over time has enhanced our rate of success after the surgery, because when we send you home after doing the surgery in the hospital, we've done 2 separate tests to confirm that you don't have a leak. We do an endoscopy where we submerge the sleeve underwater and we fill it up with air. At the same time, we're looking inside of it with a camera, and we look at the staple line. We make sure that there's no tiny air bubbles leaking out. That means that it's airtight. The next morning, before you go home, we do a swallow test where you drink radio opaque dye. You stand in front of an X-ray machine and we watch a movie of the dye going through. And that shows us two things: that there's no obstruction in your sleeve, the contrast goes through without any problem, and there's no leak of the contrast from the sleeve. So before you go home, there's been several tests to make sure that everything looks good. So you go home, there's no question that there's anything wrong with the surgery. And you come back a week later and we see you every month after the surgery, which I believe is critical to your success. Some groups will see you every 3 or 6 months, which is plenty of time to go off the rails. And we don't like that. We also want to celebrate your success with you every month. That's a fuel that that really drives us to celebrate your success and see how well you're doing. And the happy smiles of my patients, successful patients coming in, is really gratifying. But even if you have a month where you are sliding off the rails and starting to derail, we'll nudge you back on. We're not going to slap you on the wrist or punish you. We're going to give you the tool that you need to get back on track.
So if you're doing some of these surgeries in the surgery center, how do you get your dye test?
Yes, so the dye test is something that we do for our hospital patients because they tend to be larger and higher risk, more revision surgeries. For a primary sleeve that we do in the surgery center, we've reverted to just doing the endoscopy, because that's something that we can do and also send you home immediately or within 2 or 3 hours after the surgery. If there was any issue, we could certainly bring you back in for the dye test for those patients as well.
I also wanted to, before when you were talking about the sleep studies and nutrition assessment and all of that, I think one of the great things that the New York Bariatric Group has that I don't see anywhere else is that we can do a lot of that testing within our own group.
Yes, and that is a huge benefit for our patients. So instead of going around to 5 or 6 different offices like you would if you went to another practice and taking 5 or 6 days off of work, you can come into one of our offices and have all of your testing done in one day. So you will see the dietitian, you'll see the psychologist, you'll have your endoscopy, you'll have your cardiac testing, and you'll see all of these expert doctors and health practitioners in a one-day visit. And then at the end of that one-day visit, you will be cleared for the surgery and you could potentially get a surgery date. So I've seen patients actually go from my office, from the first office visit to surgery in 2 weeks.
Wow. I wish I had that turnaround.
Yes. So this is something that we can offer, and it's not everyone, but in the right set of circumstances, we can get patients through this procedure very safely. The primary goal is safety. That's why we do all of that extra testing that's not always required by insurance, because what's required by insurance is the minimum. We've always believed in going above and beyond the minimum because we want the best results for our patients. So that's why we continue to do endoscopies and these other tests that most surgical groups have abandoned, mostly because it's logistics. They don't want to annoy the GI doctors in the hospital, or it's difficult for them to get the endoscopy cart up to the operating room. But we don't have any of those holdups. We only believe in doing what's best for our patients, despite any hurdles that may be put in our path.
I think you've helped me with some of my own hurdles as I've been getting going, and I thank you for that. So, not only are you an advocate for your patient, but also your colleagues.
Yes, and it's a pleasure to work with you, and we are so lucky to have you here, and our patients are lucky as well. And I think, unless there are some other questions, which I don't see, I do thank everyone who has come on to the meeting tonight for your attention, and we look forward to seeing you in person in our office, where we can talk to you about weight loss and any type of plastic surgery. I know Dr. Mastroianni does other types of plastic surgery as well,
Head to toe.
And head to toe, and she's happy to help you even with concerns that are not linked to one of my surgeries. So feel free to call us, email us, and we look forward to seeing you. And I'm going to turn it back to Megan if she has any closing remarks, or Sandy.
No, I don't see any other questions at this time. So I want to thank everybody for joining us this evening, and have a great night.
Have a great night. Thanks again.
Take care.
Thanks, everybody.
Bye.